So, my perspective, what's happened over the last 20 years? 25 now, almost 30? And, we went from paper to electronic, and that was gonna fix everything. Well, all it did was make us documenticians. You're trying to go from clinician to documentician, and that's hard, it's harder to do. And, payment reform. So people are, and that's what's happened. If you look at when people say it's frustrations, it's also about the money. The buying power associated with being a physician has gone down since 1997, when Bill Clinton signed the Balanced Budget Act. And inflation goes up, but we're kind of capped. Nobody's poor, but you're capped as far as your ability to generate revenue. The thing I worry about most is this less time to interact with the patient and the family, because that's really where the joy of medicine comes from. And then uncoordinated efforts to manage all aspects of us. Your quality, safety, compliance, documentation, RVU targets, revenue cycle, research grants, resident milestones. How many of them do you have to fill out every day? Medical student engagement, patient satisfaction, it's on and on and on and on. And we feel like you're getting boxed in a little bit, but I think that we need to care, because the process may be preventing us from connecting with the patients, the families, the residents, the medical students, which I really believe is what the secret sauce is to being some type of teaching facility. And so I think that our goal is to try to make that better. So what's the most common response to talk on peer and professional review? You show up, everybody just says that. And it's like sad. Like, what do you mean? You're coming to tell me that I need to be better? Well, no, we're trying to figure out ways to make the system better and recognize that there's differences in people. And so what's the cell? The cell that we came up with was, number one, if you can't ever say accountability to physicians. It's like always like, we're gonna hold you accountable. But the flip side is, which we can all be accountable to each other and the patients, but you got to figure out this advocacy part of it. You got to be there to tell people, listen, we got your back, as well as it's, you need to do all the right things. And so when we thought about this, you think of, and I don't know the residents really, whether you see this, but the attendings, you see like a spreadsheet with 50 lines on it with red, yellow, and green boxes that you're supposed to react to. All it does is make you want to throw up. And so what you're really trying to do is like, how can we create something that people look at and visualize and get some feedback associated with that? So we thought simple, relevant, actionable, and automated. Because if you're doing something by hand in 2026, shoot, if you're doing something by hand in 2010, it wasn't going to be sustainable. So we got to do something that's sustainable and utilize this process to understand the stressors on providers and take the next step, which is to inform administration of the opportunities for improvement. Those are the things. It's not just saying, oh yeah, we recognize this is a problem and then throw stones at everybody. It's actually going out and doing something about it to make the system better. And so create high reliability processes for the safety of the patients. That's our responsibility as well. And so when you talk about high reliability, what does that mean? It means that we do good work every time. We're not landing the plane in the ocean. And so we got to have the leadership that backs you. You got to have highly effective process improvement. You got to have safety culture, in this case, as it pertains to peer and professional review. But you got to believe that we can talk about mistakes and we can talk about challenges, because as we look at those things and we look back on them, it's really easy. We've all been there in the middle of the night trying to figure out what to do with a patient, and you hope they're going to get better, and they don't. Well, can we go back and look at that in a blameless way and say, how can we do this better without making people feel like you're targeting them? And so that's a safety culture. And so this establishes trust in the system of reporting. You let people know, yeah, we had a bad outcome, could have done this, but we did this. Well, let's look at that and share that with people so that you and your colleagues figure out how to do it better. And that balances learning with accountability. You got to learn in the system, because there are, when you're dealing with biologic systems, it's all over the place. You can't be smart enough. I'm not smart enough. Ed may be smart enough, but I'm not smart enough. And we're not clairvoyant. We can't see the future and what's going to happen in all the different factors. So we have to be able to separate those blameless errors and establish one code of behavior, because on one hand, we have blameless errors. On the other hand, we really want to ensure that we're collegial and we're able to work with people.